Good evening, everybody. This is Dr. Michael Patmos, and I have what I hope you'll find to be an interesting video. Before I go into any detail, let me just tell you that I am a board certified internal medicine physician with 45 years of bedside practice experience taking care of patients. And I am qualified to speak about this topic. So, what am I going to talk about tonight? Well, what interested me, and if you read below in the text, you will see that Aaron Parnas, who is a young independent investigative journalist and a lawyer, has a fantastic website and a Substack where he does daily and sometimes multiple times per day updates on what's going on in the government and with Trump and so forth. And his Substack today was really fantastic. In it, and I attached the link in the photograph below, he showed a picture of Donald Trump, presumably at Davos, where he's been for the last few days. And that picture shows his hand, particularly his this time his left hand, and it has a very big ecchymosis or bruise over the dorsum of the hand. The right hand looks normal at this time. If you recall, a few months ago, the president was observed to have significant lower extremity swelling. There are pictures that were all over the news media showing that he had what we would call 3+ to 4+ edema of the lower extremities. His lower legs were so swollen that his ankles were almost folded over his shoes, and that's significant lower extremity edema. And if you recall, he was evaluated, and his doctor said that he had venous insufficiency, which is one cause for lower extremity edema. But it was observed at that time that he had a bruise on his right hand, and there was all kinds of speculation that he might be, getting some kind of medical treatment. The White House press secretary said he got a bruise from shaking hands from so many people. That was the that was the way they tried to pass that one off, and it kind of fell out of the news. His ankles do look a lot better, um, but then today, there's this picture of him with his left hand with a similar bruise. So now I'm not making a diagnosis. I'm not practicing medicine, not treating the patient or divulging any diagnosis. I'm just speculating about the kinds of things that could cause a person to have lower extremity swelling and then to be getting intravenous infusions. Presumably, those are intravenous infusion sites, where they put in an IV, and sometimes you get some bleeding because it's hard to, get you don't always hit the vein right. Or it could be from a phlebotomy. You can do phlebotomy at the dorsum of the hand also, but that's not the best site to draw blood. It's much better to get it from the antecubital fossa. The veins are bigger. This is most likely an intravenous site. If any of you have been in same-day surgery or been to the hospital, you know that they often will start IVs in your hand. Well, anyhow, that's what I suspect. These are IV sites, and they had some bleeding, one time on one hand, one time on the other hand. So I thought I would do a little video about what kinds of medical problems can present with lower extremity swelling, lower extremity edema, that then subsequently result in requiring intravenous infusions. Well, the list is long, and you can see from the list below, this is real internal medicine for you people who don't understand what internists do. This is the core of internal medicine, is working through a differential diagnosis like this. There is a long differential diagnosis for patients who present with lower extremity swelling and then end up getting intravenous infusions later. And they include things from, cirrhotics and nephrotic syndrome and all kinds of vasculitis and portal hypertension and, all sorts of things. But probably the most common, at least, my experience, the most common is actually heart failure. Congestive heart failure or cardiomyopathy often presents with lower extremity edema. It can also present with shortness of breath and positional shortness of breath, orthopnea, or waking up at night, short of breath, paroxysmal nocturnal dyspnea. But it's very, this is any of you out there who are internists will corroborate the fact that heart failure, cardiomyopathy, left ventricular dysfunction, right ventricular dysfunction, or biventricular dysfunction, often presents with lower extremity edema and requires aggressive treatment. Now, typically the treatment for that is oral diuretics and other kinds of drugs, afterload reducers like hydralazine and so forth. But a more recent therapy, and one that's been shown to be quite effective, is intermittent infusions with dobutamine. Dobutamine is a positive inotropic agent, makes the heart kind of beat a little stronger. And when given with some diuretics, you can mobilize the lower extremity fluid and then temporarily increase the strength of the contraction of the heart. And that's given usually in either weekly or biweekly. It could even be less often than that, but it's an intermittent IV infusion. Now, that would make the most sense to me, as lower extremity swelling. He's getting intermittent infusions. He had a bruise a couple of months ago on one hand. Now he's got a bruise on the other. I think he's getting intermittent infusions of dobutamine. He might have gotten that before he got on the plane and flew to Davos so that he would have a little positive inotropy. So, that's just speculation on my part. Who knows what he has? I don't know for sure. I'm not his doctor. I'm not practicing medicine. I'm just speculating based upon what's in the public domain, and doing my best to try to educate the public. Now, what happens if the president of the United States has a serious medical illness? Well, he doesn't have to disclose it. There's no law that says that the president has to go on TV and say that he's got an illness. He was very critical of President Biden for not disclosing his Parkinson's disease or his other medical problems. But here we have the president of the United States now who has some kind of medical problem. Whatever it is, it's not benign. This is not benign, and it's not trivial. It is a significant problem. If you're getting intravenous infusions every couple of weeks for lower extremity edema, if it is due to heart failure, that's a serious problem. So does the president have to disclose this? No, he doesn't. He doesn't have to disclose it. But there is a mechanism by which, if he gets really sick, he can relinquish power under the 25th Amendment to the vice president, or if his cabinet members and Congress agree that he is no longer fit to serve, they can take power away and it would fall to the vice president. That's under the 25th Amendment, but that's a very complicated situation. But many presidents have withheld their medical issues. There's no law that says a president has to disclose their medical issues to the public. FDR, for example, had polio and was paralyzed, which you probably don't see anymore nowadays. But we will soon see it again because polio is going to come back because we've got the CDC, ACIP advisory board chairman saying that polio vaccination probably doesn't need to be done anymore. That's right. That's what he said today. In any case, you may see polio again. But for those who don't know this, FDR had polio and he kept it from the public until after I think everybody knew, but he didn't display, which is his legal right. So now, what if the president does have heart failure and he's getting dobutamine? Well, dobutamine alleviates symptoms. It does not alter survival. If you have that degree of heart failure, your days are numbered. It's not a curable condition unless you got a heart transplant or some other left ventricular assistive device or something like that. This is, it's a condition that, will take you at some point. The prognosis could be months to a few years, but generally patients who have that bad of heart failure that they're requiring intravenous dobutamine intermittently, they're usually in the last years of life. So, how long the president will live, I don't know. I can't speculate on that. But I thought you might find that interesting. If I had to put my nickel, that's what we do in medicine. A lot of times doctors will sit around in doctor's lounge and try to, speculate on what what a patient might have, and they're sort of debating back and forth. If I had to put my nickel, I put my nickel on ventricular dysfunction, either right-sided heart failure or left-sided heart failure, or both. Probably more likely right-sided heart failure, presenting with lower extremity edema, and he's now getting intravenous dobutamine infusions, and that's why he has bruises on his hands. I wish him well. I hope he is as healthy as long as possible. But, he does have, if this is what is going on, it's a serious condition. I thought you might like to know. So that's my post for tonight, a little walk through, little mini grand rounds for you on the presentation of lower extremity edema and what someone might be getting if they're getting intermittent infusions.